Good evening. We're doing MedSurg Nursing, Brain Disorders as part 1, Seizure Disorders. Seizure disorders and epilepsy. Once again, we're going to look at etiology, the pathophysiology, and the signs and symptoms. Seizure etiology, once again, that does not imply that the person has epilepsy. Actually, seizures could be caused because of brain injuries or tumors pressing on the brain tissue itself, or infections where the fever rises too fast, or end-stage renal disease where you have electrolyte imbalances, or toxicity could be from like tetanus or bacterial stuff. Or seizures could be caused because of hypoxia or anoxic events. These could be because of a stroke, once again, stroke from a clot, hemorrhagic, a cardiac arrest where you're an anoxic event, cardiac arrhythmias where you're not getting sufficient oxygen to the brain, choking and drowning. Once again, these would cause anoxic events, and strangulation as well. And then medical condition that makes it difficult to breathe, like COPD or asthma as well. Simple partial seizures are more like a focal. They're in a certain spot of the brain. Complex, typically in your temporal area, and you may have automatism like smacking, tongue rolling, or finger rolling and stuff. Partial seizures, once again, are one-sided, but they can become generalized. Generalized seizures affect both sides of the brain. Patient typically loses consciousness. So you have other types of seizures here. Absence, which lasts maybe only a few seconds, has no aura. Myoclonic, which is more like a grand mal seizure where you have total loss of consciousness, and you also have a post-ictal state. A clonic, which is more of a sustained rhythmic jerking, and then the tonic is where your body and arms and legs stiffen up, and that's what it is. It's just tonic. And a tonic-clonic is where there's muscle stiffness and repeated muscle contraction going on. And then atonic seizures is you'd have loss of muscle tone whatsoever. And then infantile spasms, once again, usually this is actually called afebrile or febrile seizures, where the temperature rises quickly and the child has a seizure. Status epilepticus. This is a condition where you have a prolonged partial or generalized seizure without recovery between attacks, usually longer than 5 minutes. Now, this is problematic because 5 minutes the person is not getting oxygen. So we're becoming into an anoxic state, and you can have brain death, brain cells dying rapidly. Rapid, unrelenting series of convulsive seizures without intervention, intervening periods of consciousness, absence of respirations. Once again, this can lead into irreversible brain damage if this is not controlled. Diagnosis of this epilepsy, once again, if this is chronic, is going to be epilepsy. We're looking at history and actual signs and symptoms, thorough physical exam and tests. They're going to be doing an EEG and an MRI to identify what's the locus or what is the cause inside the brain. And then look at electrolyte imbalances, looking at your CBC and your CMP to look at your sodium, especially sodium that could be low or too high, that can cause seizures. Treatment, once again, treatment is to control and eliminate the cause, such as a fever or toxicity. They may use anti-epileptic drugs. Patient teaching, once again, is important. Now remember, this is where we need to be focusing on, this is a central nervous system depressant, these medications are. Diet-wise, a ketogenic diet makes the brain more acidic, which apparently decreases the seizure activity. biofeedback. Once again, maintaining a brain wave frequency that is not susceptible to seizures. So this is something is like mind over matter. And then surgery. This is the last resort where they can actually remove the focus causing the seizure. Treatment, once again, care is focused on supporting vital signs and preventing injury, but most importantly, making sure we're supporting the airway and giving them respiratory support, either oxygen or by intubation. Preferable treatment, we're going to do benzodiazepines, typically IV lorazepam. We're going to do IM medlazam and rectal diazepam. So other medications must be high enough to stop the seizure. This is like phenytoin, phenobarbital, valproate, or levetiracetam, also known as Keppra, and valproic acid, and phenobarbital and phenytoin. Clinical clues, once again, when IV phenytoin is ordered, you need to mix it in normal saline solution and flush the line before and after you give it, especially if glucose is running. Glucose is not compatible with phenytoin. Also make sure the patient is on a cardiac monitor while giving the first or loading dose, which is usually 10 to 20 milligrams per kilogram divided into 3 doses. Maximum dose for total for the adults is 1,200 milligrams. Once again, glucose is incompatible with phenytoin. Never administer IV phenytoin faster than 50 milligrams per minute. So yes, you have to calculate that out, as that can cause cardiac dysrhythmias, hypotension, and bradycardia. So we do not want to cause more problems than necessary. For patients with history of heart problems, administer the solution no faster than 25 milligrams per minute. Once again, this can cause cardiac dysrhythmias and hypotension. Observations to make during a seizure. We need to make sure we're taking note of the time that it began, when it ended, what was the patient doing, where in the body the seizure began, what part of the body, and was the eyes moving, whether eyes constricted or dilated, deviated to the right or left, or rolled upward. Other observations, we need to make sure, look at which way did the head turn. Did the patient cry out, scream, or did they have an or something like that? Did they have repetitive movements like lip smacking, chewing, grimacing, tapping, or pill rolling as well? Other observations, whether movements were bilateral or symmetrical, if they were incontinent, a urine or stool, or vomited, did they become apneic or cyanotic? That's going to be very important as well. And then changes in skin color or profuse perspiration. Just remember all of that previously to know at the initial, we'll tell them what kind of seizure it is and where is it coming from. So the post-ictal assessment, this is after the seizure. The patient, once again, we're going to maintain the airway. That is most important. We're going to monitor the length of time before regaining awareness. Presence of lethargy and confusion, that's common. Presence of headaches, speech impairments, or muscle soreness, once again, we're going to monitor that as well. And whether there is an or before the seizure began, that's something we need to ask the patient. And the effect of seizures on the patient's vital signs. Once again, you can't just sit there, you got to watch them, monitor them. That includes the blood pressure, respirations, the heart rate, and stuff. Patient teaching, once again, treatment and side effects of anticonvulsants. Making sure that they're taking the medication every day as appropriate. Watching for triggers for seizures. What triggered it? Necessity of taking medications daily. The greatest trigger for seizures is not taking the medication. Handling a missed dose. What do they need to do if they forget the dose? not using over-the-counter medications if it's not prescribed by the doc, and if they do, they need to ask, is this okay? And then schedule lab. Once again, they need a periodic lab to assess therapeutic levels of the medication. They need to make sure that they have a medical alert bracelet, necklace, or something to tell people, hey, I have seizures and I am on XYZ. Help them reach out for resources or assistance for the community. Need for proper nutrition. Dangers of erratic meals. Once again, hypoglycemia can cause them to go into a seizure. Avoiding alcohol, excessive fatigue, relaxation. Dangerous swimming alone, because you never know. They could have a seizure then and they can drown. Refraining from driving, operating dangerous machinery. Once again, typically if you have seizures or epilepsy, the DMV will not give you a driver's license because of that, unless it's truly well controlled. And then making sure you follow up on appointments with your provider, documenting if they've had any other issues and such. That concludes seizure disorders. Thank you.